Good afternoon, and welcome to Build Initiative's third webinar in a series on refugee experiences of relocation. My name is Danielle Fuentes Johnson, and I'm a Special Projects Manager at the Build Initiative. As we get started, please feel free to place your name and location in the chat box. This session is being recorded, and the recording, along with the PowerPoint resources and contact information, will be shared in the days following the webinar. As we move through the content, please feel free also to put any questions you have in the chat box, and as we have time, our speakers will address them. As the war in Ukraine has just entered its ninth month, its adverse effects on a nation of children have become more deeply rooted. And we're reminded that Ukrainian children, many of whom have been forced to flee with their families, are not the first to suffer this fate. In 2020, worldwide, close to half of the refugee and asylum seekers forcibly displaced from their own countries were children. But upon arrival to this country, many refugees of color soon are faced with the additional burdens of inequitable, racist, and anti-Black immigration and refugee policies and national sentiment. They also soon realize that this country may not provide all the solutions to their problems. As we're presenting this webinar series, it's not only to highlight for early childhood systems the experiences of many refugee families and young children in the United States, and also how racism continues to traumatize immigrants and refugees and asylees long after their arrival, but to also offer practical strategies from individuals who have experienced resettlement, as well as those who are supporting refugee families and young children in an equitable way. Our hope is that you will leave these sessions considering how you can use your influence and leadership to make a positive impact for refugee families and young children, regardless of their country of origin, religion, or color. Next slide, please. Today, our speakers, we're pleased to have with us Maki Park, a Senior Policy Analyst for Early Education and Care at Migration Policy Institute's National Center on Immigrant Integration Policy, where her work focuses on early childhood policies affecting children of immigrants and dual language learners from birth to age 8 in the United States and internationally. We're also pleased to have with us Gary Romano, CEO of Civitas Strategies. Gary's driven by the vision that no child will grow up in poverty, and he founded Civitas Strategy in 2009 to provide mission-driven organizations with the high-quality, cost-effective consulting services needed to improve outcomes for families and children. Next slide, please. All right, we'll take a look at the agenda. We're going to welcome everyone. We're going to review a few key phrases and thoughts, and then we're going to invite Maki to highlight for us some of the lingering effects recent policies have had on the refugee community, as well as some critical opportunities for policy changes that can and could better support refugee families and young children, as well as other communities which have been marginalized. Gary will then share some examples of how policies that are discussed can be put into practice to benefit families and young children furthest from opportunity. Next slide, please. And one more. Thanks. As we begin, we want to just take a moment to review how BUILD includes refugee families and young children in our work and vision towards creating a more inclusive, just, and equitable early childhood systems in order to ensure promising futures for all children placed furthest from opportunity. First, that refugee and asylee families and young children are an asset to any community they're in. That second, that systemic racism, anti-Blackness, colorism, and anti-Muslim sentiment are the basis for the myths and misconceptions that permeate public perception of refugees and asylees and continue to influence policy and national sentiment. Next slide, please. The strategies and system components supporting refugee families must be in place and coordinated to respond to their diverse needs. And that to be effective and culturally responsive, these strategies need to be informed by, created in partnership with, and have key decision making with the community in order to be effective. And finally, that strategies and system components for refugee families and young children must support retaining their home language and culture for these children to thrive. Next slide, please. Let's take a look at some of the terms we'll use today. As we move through this session, we'll use the term refugee, and these are typically people who are outside of their country of origin because of feared persecution, conflict, violence, natural disaster, or other circumstances which have seriously disrupted public order. Right now, large groups of refugees in the United States are from the Democratic Republic of Congo, Burma, and Ukraine. These lists change on almost daily basis, depending on world events. The other term we'll use is asylum seeker. These are people whose request for sanctuary has yet to be processed. Every year, around approximately 1 million people seek asylum. Currently, again, and this can change, the larger groups are from China, Venezuela, and El Salvador. Also of note, as we familiarize ourselves with these terms and definitions, is that refugees and asylum seekers, even when from the same country, are not monolithic. They arrive in the resettlement camps and then in the US from various socioeconomic, educational, religious, cultural, and linguistic backgrounds and have had different experiences of resettlement. Next slide, please. So as we've seen from the sessions previous in this series, as well as from maybe our personal and professional experiences, we know that refugee families with young children face several unique challenges and barriers to services in the early years. As Dr. Monica Noriega reminded us in our previous session on refugee trauma, even the way systems are designed can continue to perpetuate and inflict new trauma, and that childhood trauma is less likely often to be recognized in these communities. It's critical for us to keep in mind the need that many of the challenges refugee and asylee families and young children face are also present in other historic communities which have been historically marginalized. And that designing systems for inclusion is the key to effectively serving these and communities and other populations, both in terms of accessibility as well as program quality and relevance. So with that, we are really pleased to invite Maki to help us understand the effects recent policies have had on refugee communities, as well as some critical opportunities for policy changes that could better support refugee families and young children and other communities which have been historically marginalized. Maki?
Thank you so much, Danielle, and thanks to everyone for being on the line today for this conversation. I'm just really honored and delighted to get to be a part of it. So I wanted to start first by giving an overview of what I plan to cover in our time today. I'll be starting off with just some context setting about the demographics of this population, why this issue is so important for every state in the country, not just those that immediately come to mind when we think of refugee resettlement, as well as some policy pieces that are important for understanding some of the background and context of this issue. And then I'll dive into speaking in greater detail about a few key policy and system challenges that we at MPI have been working on related to this population. I'll talk about language access, I'll talk about workforce diversity, and I'll also talk a little bit about trauma and trauma-informed care, which I know was a topic of deeper conversation in an earlier webinar. And then the latter part of my time, I'll spend looking forward at policy opportunities to improve the accessibility and the relevance of early childhood services to really effectively serve young refugee children and support their families. Next slide. So let's begin first with some context setting. I always like to start these kinds of conversations with a look at demographics because I think these numbers are so important and they often just aren't top of mind when we think about early childhood policy, but I think they should be. So while we're talking primarily about young children and refugee families today, as Danielle raised for us already, refugee families are a subset of immigrant families, and many of the issues that are important for children in refugee families are also important for all children in immigrant families, and also vice versa. And this is important because I think these issues often come to the forefront at those times and at moments when specific groups are in the news, capturing our attention, and yet many of the policy areas where we can really move the dial to support these families are all the time issues, not one-off issues that we can solve or address at a moment's notice. If we want to have systems that are ready and capable of serving refugee families well, we need to have built systems that are inherently equitable and inclusive for all children. So in many ways, putting in the work to design and implement equitable systems and programs for refugee children is, as Danielle said, going to be beneficial for so many other marginalized groups as well. And as I was saying, these are issues that touch so many families across all 50 states. So today in the United States, 1 in 4 of all young children ages 5 and under lives in an immigrant family. And an even larger proportion, 1 in 3 of all young children are what we call dual language learners, or children who have at least one parent who speaks a language other than English in the home. So yes, the issues that we'll be talking about today touch all 50 states and are relevant for all early childhood systems. And for refugee families specifically, the United States has historically been the world leader in refugee resettlement in terms of numbers of refugees resettled each year. And this remains true today despite declining numbers in recent years. You likely know that under the Trump administration, refugee allotments were reduced to record lows. And while the Biden administration has pledged to reverse course on this trend, numbers remain relatively low, with only 11,500 refugees resettled in fiscal year 2021. But beyond sheer numbers, I did also want to talk about the diversity of refugees that are resettled in the United States, since this has significant implications for issues that we'll be discussing, like language access. Next slide. So what you can see here on the left, you see historical data on the regions that refugees resettled in the United States have hailed from historically. You can see there's quite a bit of change over time. And on the right side, what you see is a breakdown of the top 10 countries of origin for refugees who arrived in the United States in the most recent fiscal year. So you can see from these numbers that individuals and families are arriving from a highly diverse set of countries, cultures, and circumstances. And the languages that are spoken by those who arrive are also extremely diverse. And I'll speak more to this in a moment. Next slide. The other piece I wanted to speak to in terms of context setting is related to policies surrounding immigration, and in particular, the public charge rule that I'm sure many of you have already heard quite a bit about. But just to give a quick overview and reminder, public charge as a concept is essentially an attempt to determine whether an individual is likely to become dependent on government benefits, which is the definition of being a quote unquote public charge. Essentially, it's a ground of inadmissibility, meaning that it can be used as a reason why a person could be denied a green card, a visa, or admission into the United States based on the reasoning that they could become dependent on certain benefits. The public charge rule put into place by the Trump administration was officially published in 2019, and it was in effect on and off for parts of 2020 and through early 2021. And the effect of this rule was essentially to broaden the previously existing definition of public charge so that certain immigrants who received services like Medicaid, supplemental nutrition assistance through SNAP, housing assistance, energy assistance, childcare subsidies, and many other benefits could now be labeled as a public charge, which has extremely high consequences. Politically, this was framed as a way to limit migration, but the other extremely worrisome impact it had was to prevent immigrants here in the US from using public services that could be beneficial for them and for their children. So for those already in the country, being deemed a public charge can bar immigrants from becoming lawful permanent residents. So during this time, many immigrants, including those for whom this law technically did not actually apply, were understandably hesitant to utilize public benefits of all kinds. It had what we call a chilling effect on a much broader population of immigrant families by creating this general culture of fear and confusion about what kinds of services were safe to use. And while this rule is no longer in place as of 2021, the chilling effect is still evident, as research has shown. So there are still pervasive fears around being asked for documentation for participation and enrollment in a number of different services, including early childhood services, as a legacy of this rule. So a lot of mistrust around institutions, and many families who were already less likely to be reached by services are even harder to reach than they were previously as a result. Next slide. So with all of that said, I'm going to be talking about a few key issue areas. These are by no means exhaustive. We definitely have to pick and choose given the time that we have together. I do think that these are all very important issues. They also happen to be issues that we at MPI are currently working on and have resources around. But I, of course, won't be covering all of the policy areas that could improve services and outcomes for children and refugee families because they are many. Next slide. The first piece I'll speak to is language access. So as we've been saying, language access is an issue that touches all immigrant and DLL families, not only refugee families. However, this is a particularly salient issue for many refugee groups, because if you recall the slide that I showed you earlier, refugee groups are very diverse, both culturally and linguistically. Even groups that are arriving from the same country may speak different languages and different dialects. And why this matters is because it is very challenging to provide adequate translation and interpretation services for a wide number of different languages, especially given that, as you saw in the previous image, countries of origin of arriving refugee and immigrants are always shifting. And this means that in many states, many counties, many cities, the language profile of the families they serve is also always shifting. So having the capacity to really respond to all of the linguistic diversity is admittedly a huge challenge. And this is exactly the kind of thing we mean when we say that we need to be systems building for equity and inclusivity everywhere, all the time, for all families. Language access needs to be baked into our definitions of quality if we're going to have inclusive services. As it stands now, in many states, programs can be highly rated on QRIS, even if they do not have the basic capacity to provide translated materials to families they serve. That means that a refugee family could walk into what is considered a high quality early learning program, but not be able to get any information about the program or communicate with anybody in that program. Conversely, many home-based childcare providers that have staff that speak the home language of the families they serve may not be rewarded or incentivized in any way to provide those services. So really making sure that language access is included in our definitions of quality as a need to have, not a nice to have. This is critical if we're wanting to reach some of our most vulnerable families. And the last thing I want to say about this is that this is an issue not only for families, but also for providers. So that home-based provider that I was just talking about, do they have access to QRIS and subsidies and professional development opportunities, even if they have limited English skills? In many cases, maybe not. We've done a review of state CCDBG plans to look at what states are providing in terms of language access in their childcare systems, and we know that many are not providing basic translation. They may have a Google Translate button on their website, but we know that's not sufficient. They may also offer language helplines, but oftentimes the wait time for these phone lines can be several hours. There are just so many barriers for workers who speak languages other than English to access our systems. And yet there is such a high need for language diversity in our systems, which takes me to our next issue in the next slide. So workforce diversity follows nicely from the language access issue because, of course, we want more workers in the early childhood field who can speak the languages of the families they're serving. And this representation and diversity is so important, not only for reasons of language and accessibility, but also because of culture and trust and relevance. And the good news is that our early childhood workforce is actually quite diverse, especially in comparison to the K-12 teaching workforce. And the early childhood field is a relatively accessible one for immigrants and refugees, with immigrant women overrepresented in this field. However, the troubling news is that the workforce is currently highly stratified by race, ethnicity, and language spoken. What this means is that the higher the pay in a position and the more elevated the role, the less likely you are to find diversity. So we see huge representation of immigrant and refugee providers in the informal workforce and family, friend, and neighbor care, as well as home-based care, and much fewer in center-based care, and even fewer as center directors or preschool teachers. Many of these workers are highly undercompensated, and many are also experiencing food insecurity. And all of this, of course, has ramifications for the children who are in their care. And this is because despite the fact that so many immigrant women are doing the work of caring for kids, and are in many cases highly competent and skilled on top of bringing valuable language and cultural skills, there are many barriers to becoming formally licensed and advancing in the field. An increasing professionalization of the early childhood field means that higher credentials and education that are out of reach for many workers who have limited formal education and limited English from their home countries. So we are in fact in danger of pushing out many of the same workers who we would very much want to be holding on to. And in general, one area that we at MPI have been pushing on for the past several years is really trying to increase recognition of the importance of FFN care, in particular for immigrant and refugee families. There's this false notion that FFN care is care of last resort. And this myth is just so far from the truth for many immigrant families who are looking for that cultural match, that language match, that feeling of safety and trust and community. And FFN care is where they find those things they're looking for. You can imagine that a family with a history of displacement and traumatic experiences would prioritize a sense of safety and trust above all else in seeking care for their young children. And for these families, their definition of quality care is just going to be different from what a white middle-class family might be looking for. And it's so important that we honor that and that we make it possible for families to make these choices that are right for them. So when we talk about workforce diversity, we mean diversity in language and culture and race, and also diversity in the types of care that families are able to access. And I'll be speaking more to specific policy opportunities that we see on this and other issues in a moment here. Next slide. Yeah, so I first wanted to talk about this last issue area on trauma and refugee families. And I know this was covered previously, but I just wanted to do a recall and mention some policy relevant pieces here as well, because we all know that socio-emotional and mental health are so critical to well-being, especially in the early years. And infant and early childhood mental health have for sure been gaining increasing visibility, as the idea that trauma that occurs in the early childhood years is unlikely to affect them in the long term has been thoroughly debunked. And we now know conversely that adverse childhood experiences have really powerful long-term impacts and implications. However, the intersection between infant and early childhood mental health and immigrant and refugee issues is still often overlooked. And one issue, as Daniela mentioned, is that we lack appropriate instruments to identify trauma in this population. I'm sure many of you have heard about adverse childhood experiences, or ACEs, and how ACE surveys are designed, are used to identify prevalence of childhood trauma. But the way that ACE surveys are designed are in many ways unlikely to pick up specifically the types of trauma that many children in immigrant and refugee families are most likely to have experienced. In general, ACE surveys that are commonly used largely focus on conditions in the home environment, rather than the surrounding community or outside actors. So these surveys typically do not ask about past or ongoing violence in their home countries, tumultuous migration journeys, experiences of discrimination or difficulty adjusting to a new society, as well as things like risk of deportation, which we know is a huge stressor and so disruptive for so many. And yet we know that many children in immigrant families, and especially those in refugee families, are disproportionately likely to encounter traumatic events and other challenges to their socio-emotional health. And then another point that could add to the under-identification and under-recognition of trauma in young refugee and immigrant children is the lack of screening that's available for children in the refugee resettlement process. So although refugees who are resettled in the United States are initially provided with a comprehensive health assessment and referrals to health services, there are no specific standardized guidelines for mental health assessments across states. Not all states offer mental health screening, even for refugee adults, and very few are consistently screening children. The most commonly used mental health screening tool, called the Refugee Health Screener 15, or the RHS 15, which was developed to be a culturally sensitive tool specifically for identifying emotional distress in newly arrived refugees from varying backgrounds. This tool, as the name implies, is only intended for use for those ages 15 and up. And there's currently no equivalent instrument for refugee children who are under age 15. And actually, the few mental health services that are tailored to refugees also tend to focus on adults and older youth, with no specific considerations given in most cases to issues like maternal health, despite what we all know to be the well-documented effects of maternal depression, for example, on the development of young children. So all of that said, despite the prevalence of trauma that we know exists for this population, and in particular, the level of complex, sustained trauma that many children are likely to have experienced, this is still not an issue that is as visible as it could be in the policy realm. And perhaps as a result, the resources we have to address these issues are also relatively few. Trauma-informed practices and programs designed to support this group are limited both in the early childhood field as well as in the mental health care and as part of the refugee resettlement process. Next slide. Okay, so now we can finally move to talking about policy opportunities and looking ahead to possible solutions. So I'll be kind of pulling on the thread of each of the issues we've talked about so far to talk about opportunities in each of these areas. So going back to the first issue of language access, and really to all of the issues we've touched on, one of the most important opportunities I always like to talk about is just data advocacy. Really just driving home the fact that we cannot serve these children well, and we cannot serve them equitably if they're invisible in our systems. And we can't provide language access to families across cities, counties, and states if we don't know what languages are spoken by the families that we're serving. So in general, if you were to ask a program administrator, for example, how many dual language learners are being served in their early childhood programs and what languages their families speak, you would want them to have an answer. And in order for them to have an answer, they need to have data collection and reporting structures in place that many times are often lacking. We need to be gathering this data and we need to make it available because language profiles, especially at local levels, are always changing and we can't make assumptions. Gathering this data also helps us understand where remaining gaps are in services and help us to engage in better program improvement for dual language learners and children of immigrants. I think people often look for answers on how to help refugee families, again, when we hear about acute crises, but these are the kinds of systems building steps we need to be taking all the time so that we're ready to meet the needs of diverse families when they arrive and also meet the needs of the diverse families that are in our programs right now. But of course, data is not enough. And when it comes to language access, we also need accountability and we need resources. So for example, we at MPI have been advocating for the past months as McV reauthorization moves forward to include more data and targeting around home languages spoken and parents' English proficiency status, since we know that home visiting currently underserves families who speak a language other than English. We need language access written into the letter of the law of programs to make sure that it doesn't fall through the cracks. We've also been reviewing state CCDBG plans related to language access to look at what states are doing to make childcare support accessible to limited English proficient families as well as providers. Right now, in those state plans, this is really just a list of checkboxes that ask states to check yes or no to whether they've provided translated materials, whether they provide a translated website, whether they do outreach in the community, whether they have an interpretation hotline. But what we hear from advocates on the ground when we ask about these provisions that are written into state plans, what we hear many times is that regardless of what's in the plans, these things are not happening in reality. And there's just no way to know that. The implementation is not there because the accountability is not there. There really needs to be a realistic reporting mechanism, things like receipts for translation services that have been provided or a written language access plan to make sure that access is being provided in actual practice. At the same time, beyond language access, there are other steps that can be taken to reduce barriers to enrollment and participation. Thinking back to the chilling effect of immigration policies, what can we be doing to reduce paperwork and documentation burden for parents and also for providers? What information are we asking for that may not be necessary? And going even further, what legislative barriers might be in place that we may be able to change? Last year, in 2021 in Colorado, for example, advocates for immigrant early childhood workers pushed to pass a law eliminating lawful presence in the United States as a possible factor to determine eligibility for any state or local public benefit, including things like childcare subsidies, to eliminate this as a barrier to access, which is an incredible step forward. And then the last point on this slide here speaks to the issue of workforce diversity. So if we want refugee and immigrant kids to have providers who speak their language and who their families can trust, what can we be doing to help make more realistic pathways for immigrant and refugee workers to enter and advance in the early childhood field? What are we doing to provide coursework and professional development opportunities in languages other than English? And where are we providing these opportunities outside of traditional institutions of higher education that may be inaccessible and unwelcoming to so many? What can we do to reward the competence and the strengths, not only language and cultural skills, but also the years that many of these providers have spent providing high quality services? How can we recognize these competencies and integrate them into our licensing and credentialing systems? I know these are big questions, but I really believe that finding strategies like these to recognize and reward the skills and diversity that we have in the early childhood workforce is going to be so critical, not only for addressing the ongoing shortage of workers, but also for maintaining and developing the workforce we need to be responsive to the diverse families we serve. We recently put out a commentary, for example, looking at promising apprenticeship models that are helping to advance bilingual workers in a financially sustainable way to contribute to the early childhood workforce. There are definitely many pockets of promising practices out there that can be expanded and can be replicated. Next slide. So a few more possibilities on this final slide. I spoke a little bit earlier about the advocacy that we've been doing with McPhee, or the Maternal, Infant, and Early Childhood Home Visiting Program. Because of so many of the issues that I've spoken about already, on the one hand, the mistrust that many families have of institutions, and understandably so. On the other hand, the many difficulties and barriers, including language, but also other administrative barriers that families can face in accessing programs. And then also the intergenerational community trauma that many refugee and other immigrant families have experienced. If you think about all of these compounding challenges, I think you can really see the hope and the promise that could be offered by a 2-generation family-oriented program like home visiting that really has the potential to meet families where they are and address the issues they face in a holistic way, while also building trust with parents in a program that's highly relational and one-on-one. We really see the promise of home visiting for immigrant and refugee families. And we also know of many programs that work particularly well with immigrant families, which you can read about in the policy brief that's highlighted here. And yet, as I said earlier, we know that home visiting programs in general are currently underserving immigrant families due to many of the same barriers we've been talking about. So we really see the expansion of home visiting programs, and in particular, the expansion of culturally relevant programs, as being a huge opportunity. But we also think that states can be doing a better job of considering program models and home visiting models that may not be evidence-based by McPhee standards, but are really community-based in their approach and able to serve culturally specific communities in a more authentic way than some of the mainstream models that, despite being evidence-based, are not necessarily evidence-based specifically for families who do not speak English, families who have very different cultural contexts and different views about parenting. And this issue could be a whole separate webinar in and of itself, so I won't go into more detail about this now, but would love to connect with anyone who wants to hear more about home visiting specifically as a strategy to reach refugee families. The next point, one of the advantages of home visiting, I think, is that it is a place where we can provide some mental health support and 2-generation resources around recognizing, understanding, and approaching trauma that's harder to do in other settings. Beyond this, though, there are other opportunities to bring increased resources around infant and early childhood mental health to this population. For one thing, states can improve guidelines for preventive screenings and diagnoses of young children's mental health and offer increased trainings around the specific types of trauma and how that manifests for immigrant and refugee children. And thinking about the concentration of immigrant families who are served in home-based care, also thinking about how resources like infant and early childhood mental health consultation can be touching these sectors of the workforce to really provide the support where it's needed. And we talked about diversification of the early childhood workforce, but similarly, the need for diversity and language skills in the mental health field is also immense. Thinking about ways to develop pathways for diversification in this field so that more families have access to culturally responsive counseling and support is critical as well. And then this final point I'll touch on that I know Gary will speak to in greater detail is the need for increased collaboration and connection between refugee resettlement agencies and early childhood systems. We know of instances where state refugee resettlement services have partnered, for example, with Head Start in ways that have really helped to identify key barriers to refugee families' access and improved outreach and services to increase their enrollment and participation. We're really reaching out from both sides to connect families to those needed services, whether it's around mental health or early learning or other needs for family support during these children's early years. We know that navigating early childhood systems is so challenging for anybody. Anything that states and systems can be doing to connect the dots for families and take that no wrong door approach so that they can access the services they need, regardless of where they're showing up, is such a valuable way to support families. And before I close, I just wanted to point out one last quick resource, which is linked in this slide here. And these are newly released state DLL fact sheets that provide a lot of that basic sociodemographic information about DLLs at the state level, which can be really helpful with advocacy and just getting a handle on key issues that may be especially relevant for you, depending on where you are and the early childhood context in your state. So I will stop there. Thanks again, Danielle, so much for the opportunity to share, and happy to follow up with anyone who has questions about any of these points or opportunities.
Thank you so much for helping us have a better understanding of recent history and how that impacts this community, as well as some really tangible ideas to take away and put into practice. Again, please feel free to put any questions you may have, and the contact information and the resources will be shared out after. The resources are also linked in the chat. Now we'd like to invite Gary Romano to share with us some examples of what this can look like in practice. Gary? You're on mute.
There we go. See, I was trying to be so careful. So before I dive in real quick, I know there was one question that wasn't answered on a 2-gen approach and what that is. And just real quick, because there's a number of definitions, but typically is when you're working concurrently with the child and the adult in their life, right? A caring adult. So that doesn't necessarily mean their parent, it could be others. And we could argue about the details of it, but I didn't want that person to sit there scratching their head. So as Danielle just mentioned, I'm going to dive into a couple of examples of what's happening out in the field. And the first one is CDF Action, which is a community-based organization in Clarkston, Georgia. And by the way, we are privileged to have Roberta Malavinda in the audience today, who is the executive director as well as a friend for many, many years. And Roberta does incredible work, and Roberta will later chastise me for saying this, but she's always open for a conversation about what she's learning. So CDF Action is in Clarkston, Georgia, which is home to over 60,000 refugees. So we've seen this in a number of communities in Georgia as well as other states where there are, communities that have particularly high concentrations of refugees. And see, Roberta even gave her email. She's so wonderful. They focus on community building within Clarkston, refugee engagement, and equitable access to early learning. So as you can imagine, these items are intersecting in a number of ways with today's topics. And you can learn more at CDF Action or by emailing Roberta. We can go to the next slide. We can talk a little bit about what they've been doing. And, and this is, we can go to the next slide. Great. So there's a few things. They've been doing many things. And, and to be clear and fair, this is a distillation. So these can go into much more detail, and there's many other things they're working on. But I want to pick some of the ones that I thought would be most interesting to all of you today. One is a CDA program. So this program helps refugees, it recruits them, helps them to get a CDA and employment with a Head Start grantee, a local Head Start grantee. So going to Maki's point about, the workforce and how do we ensure that we have a workforce that reflects the cultural values, is able to speak literally and figuratively to children who are in refugee communities, as well as their parents and other loved ones in their lives. This becomes a critical way to do this. Plus, right, we're talking about a double bottom line here, because these women, and I say primarily women, in fact, I believe I want to say they're all exclusively women, but primarily women, are also gaining employment, which is great. And, another critical piece, this is again is an oversimplification of some very complex work. And I'm not trying to make this about being the Roberta Malavinda fan club, but working with Roberta for the past 17 years, she is an expert at braiding funding. And in this case, and again, this is an oversimplification, she's braiding workforce funding, Head Start funding, and private funding from multiple sources and synergy, which is not easy to do. but becomes critical because to this point of, where do we get the funds from it, right? There isn't a specific fund just for the program. But what CDF Action and Roberta are doing is not only leveraging these different funds, but also creating buy-in, creating literal investment by multiple community organizations in the outcomes of not only the program, but of course, the outcomes for the refugee community. So there's a really important kind of, two-level activity that's happening here, not only in terms of achieving the resources that are needed, but then also literally bringing in different agents in the community and bringing them in synchronicity. And again, this has increased employment and the size of the labor pool generally, but has also advanced these goals around linguistic and cultural equity that they have in the community. Another one that I think is, particularly interesting, and this goes back to a lot of what we've been talking around home-based childcare, and that's zoning law advocacy. And so they did have an effort to change some of the zoning laws so that they would allow for broader use of homes and family childcare. And what we've seen is that, as Maki was saying, what a refugee family chooses may not be the same as a middle or upper class white family in the suburbs, right? And not to say that they don't choose home care, but there is this opportunity when you do have family care. I mean, the advantages of it is, one, it's non-institutional. So many people who have very reasonable fears of institutions because of where they've been from and what's happened to them, it can be more favorable. It can be more favorable for the entrepreneur because she can start it up with much less capital, right? Get it going. She could also care for her own kids at the same time. Take some of the existing home costs and roll them into her business, so that can improve the family's fiscal status. So there's a lot of opportunities when it comes to family care in particular. And again, having these two outcomes, being able to help the adult refugee, right, change his or her circumstances, but then also create access to culturally, linguistically equitable opportunities for early care and education. And so by changing those zoning laws, which we normally don't think about, right? I have my master's degree in urban planning, so I actually think about zoning a lot, but that's a problem. But most people don't think about zoning, but it's a huge issue. And by changing these laws, this becomes an opportunity for these other elements to change, right? And without it, they do. So you see on a local level how what is seemingly an innocuous, almost kind of inside baseball change, if you will, can suddenly have these outcomes. The last item is their early learning navigators, which is helping refugees find and register in publicly supporting childcare programs, right? And what we know, and when I say we know, Roberta and others in the field, right? Because I'm not doing this every day. Know is that when you have resettlement agencies, churches, these are the people who are often already well connected with refugees and who are trusted. However, and this is not a slight against resettlement agencies, churches who are working with refugees, but they often don't know the early learning landscape. They don't know how to work the system, what is offered, how to navigate it. And so in this case, these navigators are there to help the refugees make that connection from these trusted agencies into the early learning community and actually navigate those programs, which, as we know, for anyone, even if English is your primary language, even if you feel that you are well resourced, it isn't always the easiest thing to navigate the bureaucracy. And again, here we're seeing again this braiding of resettlement funds as well as CCBDG funds and others, which is not only creating the opportunity to have these resources out there and have these navigators out there, but also again, buying interest or literally buying investment and interest and engagement of multiple community entities. So we can go to the next one. So the second one is the state of Texas. And I want to talk about this one because, again, I think that this is, another kind of interesting opportunity, less about braiding, more about the use of stimulus funds that we still have kicking around. And, I probably shouldn't put it this crassly, but, keeping an eye on time and hoping that people will have a chance to ask their questions. I think we see a lot of states who are looking for ways to spend these funds before they go out the door and they have to send them back to Washington. So I think there's a real opportunity here. And in the state of Texas, they're doing efforts that are supporting over 15,000 providers in the state of Texas. It's a state where there is a very high population of refugees. Between 2010 and 2019, 10% of all US refugees that were resettled ended up in Texas. You can learn more about their programs, these specific ones I'm going to be talking about, on childcare.texas.gov. But let me talk about the programs a little bit more that I want to highlight. And we can go to the next slide. So there's two I want to talk about. And by the way, for full disclosure, our firm has been working on two different statewide efforts with the state of Texas, including this expansion initiative. So I just want to say these are ones that the good news is I know firsthand. The bad news is, we're on the payroll for them. So I just want to make sure that that's clear. One is the child care stabilization funds. And what I found interesting as Danielle, Maki, and I were preparing for this particular event was as we talked about this opportunity for linguistic and cultural access. States like Texas and others have been providing written guidance, coaches, right? Their current call-in center for stabilization funds supports multiple languages. And, this is relying on ARPA funding, which is interesting, right? And we're already dealing with an underfunded system. So it's hard to say how will this be sustained, but at least for this given moment, the fact that states like Texas and others are investing the funds in this access in a way they've never had it before is tremendous. And like I said, it's not just the let's translate some guidance or let's have a Vietnamese language channel for a webinar. It's again extended to coaching, business coaching that's been offered, as well as that call-in center, which is critical to helping providers navigate this system around stabilization funds, which has been so crucial, as we know, to many providers and getting through the pandemic and getting ready for what happens next. The other one that I want to highlight is the Child Care Expansion Initiative, which is currently being implemented, and that started back in August. And this is a $116 million effort. It's using ARPA funds. The goal is to expand care, and we're seeing some other states doing similar work. And, I think there's a couple of things that, are interesting about the way this has been designed by the state. One is, of course, that linguistic access is there, right? But we just talked about that, and that's a great thing. But I think there's this other piece around family care friendly policies, which is crucial. When the program was developed, and we do see this in other states, and it's not going to be catty and start naming like this state or that state, right? But those of you who are in the know, there are certain states who are doing expansion initiatives that are very much geared towards centers, right? And physical plant and trying to create the maximum numbers, which is wonderful. And the state of Texas is supporting centers. However, they are also supporting family care in a number of interesting ways. And, that includes they can expand infant slots, and it's being done entirely on an attestation. So they're not going to be inspected. It's their honor system, right? They can engage in partnerships with businesses that are very, very open. So it can take a number of different forms. Childcare in deserts is another preference they have for funding. But the final one, which is really important to me, is conversion, right? So they're also paying for not only new entrepreneurs to come in and become a registered home or a licensed home, but they're paying for those registered homes to become licensed, which is a very interesting, and also listed, which is even kind of lower down on the hierarchy than registered to become licensed. I mean, to become registered, listed to become registered or licensed. And so what we're seeing in this is, of course, not only a more equitable approach to the way the slots are growing and who is benefiting from these $616 million coming out, but going back to what we were just saying about family care and the criticality, we are seeing a number of cases. In fact, I was just on with a person last week who is a Iranian refugee who is starting her own childcare, and she's starting as a licensed home. And why is she doing it? She specifically said, because there are no Farsi speaking childcare providers in our area, and we have a high refugee population specifically, and I want to serve them. And although an anecdote, we are seeing a number of those anecdotes. And again, as we talk about family care, when you see an outcome like that for this individual, of course, that's of great benefit to the Farsi speaking community in her area, the Iranian refugees for which she identifies, and she did go into the fact that it goes beyond linguistic access, but a shared experience and trauma that they've had, and that in some ways helps give the opportunity for her to help with the family to mitigate that in the child. But there's also that double benefit of this woman now also has a great opportunity as an entrepreneur and an opportunity to earn money while working from her home, including her own child in that model as well. And hopefully, because these funds are, I would argue, generous, it gives them a chance to really get past those critical months in startup, which we know, and I'm not trying to say that like childcare is easy or well-funded, but like any other startup, those first few months are even more painful than many others. So though there may be a struggle in other years for this entrepreneur, the ability to get past that initial energy of activation and get going financially is so critical. So hopefully I got through that fast enough, Danielle, because I don't want to make sure we had at least a few minutes for some questions.
Thank you so much for helping us kind of conceptualize, visualize what this can look like in practice. And I'm sure, as it is for myself at the moment, the ideas are pinging around my brain of where else this could go. We do have a couple of questions, and also thank you to Roberta for being willing to provide your access as well. One question we have is, as you're connecting with refugee women to help them obtain their CDA, how do you overcome the barrier of high school diploma?
And that's one that, Roberta, if you could chime in, I'd love it, because I know that this is embarrassing. I know we've talked about it over the years specifically, but I believe they do provide additional support for them to get their equivalent, but I could be wrong on that.
And I will say also, in our first session that we did in this series, Deborah Young and the Famoja Project, that's something that they have discussed. And hopefully there are a number of topics we'd like to continue to explore in this series, including home visiting. And this looks like another great opportunity. There's also a question around, is there a language resource that's free of cost to ECE providers to help bridge the gap with refugee families? This is especially important in communities where translation resources are limited, wondering if anyone's working on this type of opportunity. And refugee families could receive access as part of their resettlement. Do either of you know of any initiatives like that at the moment, or resources?
Maki, do you? I'll defer to you first.
Exactly the kind of thing that should be provided but isn't provided. And it's actually one of the things we're always advocating for is, just as I was saying, the number of, especially in refugee communities, there are a lot of very low incidence minority languages, and it's hard to just find an interpreter at the drop of a hat. And so we're always advocating for community hubs, regional resources. When you think about CCR and our networks, how could we be working together for economies of scale? It's just crazy that everyone's reinventing the wheel on pieces like this, like with language access. So no, unfortunately no, but I think it's a really important thing to be advocating on. I actually also wanted to go back to the last question because there are, I think that's another important thing to be advocating for is, when you think about professional development opportunities, making sure that they're available in other languages as well. But I also wanted to make a plug for some really exciting work that's happening in some community college settings. So another piece we've been advocating for in terms of integrated pathways to advancement is looking at models like iBest, which is a model that puts together English instruction, adult basic education, and early childhood learning content. So the argument there being that with the way things are currently, you would need years of just ESL to get that level of English in order to get your GED equivalent. And then from there to be able to even enroll in one credit bearing class. And the iBest model makes it possible for people to move through all of those steps in an integrated way with cohort support. So all of the content is provided in a home language while also providing that English instruction and moving towards earning adult basic education credits. So just wanted to, and I think that's such a promising practice that could also be expanded and funded elsewhere.
Well, thank you all. So there is one other question before we close out, and it was around refugees with young children. Transportation is an issue. Have either of you seen this addressed? Or Roberta, if you're generous enough to include that in the chat as well, another barrier to overcome.
Yeah, and I know, personally, I have not. I wish I did. If I could return real quick to one other point around the translation issues,
Absolutely.
I think we've seen a great opportunity with ARPA funds, and we've seen a lot of translations, but going towards materials, I think as a field, we do have a big challenge. And, one of the things we've been doing as an organization is, as we've had the privilege through different funding sources to develop easy to use guides and such for childcare businesses, we've been offering those free of charge, right? And the translation piece is hard. And so I do think that as we move forward as a field, to think about ways that we can coordinate the translation of resources, it would be critical. And I think it could be of great mutual benefit because, when you take content like ours that is offered freely, right, then it's just, can an organization get the funds or have the time to translate it into a variety of languages? And sometimes that's hard to do up front. But I think as we move beyond some of this ARPA funding, this becomes an opportunity for the field to lift itself up in so many ways and provide access in a way that it hasn't in previous years.
Thank you so much. Well, that brings us so rapidly, it feels like, to the close of our time together today. We definitely have more to explore in the series, and we're looking forward to doing that in the new year. But today, we really want to thank our experts, Maki and Gary. If you'd like to contact them further, their information is included in the PowerPoint. It's on the screen. But we'd also like to thank all of you for all that you do to ensure equitable outcomes for young families and children. And we ask that you take just a moment to provide your thoughts on today's session in the survey, which will pop up as we close the meeting. This really helps us tailor the next sessions to what is most important to you on the ground. So once again, thank you all so much and have a great end of the year. Take care.